Hey, this is Curtis Alexander. I'm a pharmacist. In today's video, what I'm going to talk about is the side effects that we can see with amlodipine. And in case you know or don't know, amlodipine also goes by the brand name Norvasc, and it's used primarily for people with high blood pressure. So the most important thing, I harp on this a lot, if you want to understand what side effects you could see, why they might be happening, it does help to understand what it's actually doing in your body. So let's start with that. So when you take amlodipine, it's a calcium channel blocker. And to give you a better overview, I covered this in my video on PEMF, but your body's electrical, right? So you have gradients in your body that produce voltage gated channels. They have to reach a certain potential to let calcium and these things into the cell. You see that in an EKG. If the doctor wants to look at your heart, then the EKG is a measurement of electrical potential essentially in your body. Norvasc is going to, or amlodipine is going to affect that. So when it blocks these calcium channels, the calcium won't get into the cell during the depolarization component of your heartbeat. The end result is that you're going to get a lowering in your blood vessel resistance. You'll get a dilation. As you get a blood vessel dilation, your blood pressure will go down, which is what we're trying to have happen with amlodipine. So far, so good. Now, what sort of side effects do we see? By far and away, the most common one is going to be edema, or you're going to carry more water. You're going to get that edema skin that people can see. So what is going on? There's a big range. We can see this in anywhere from 2 up to 15% of people who take amlodipine. And what we see is that your body, because of this vasodilation that's causing the decreased blood pressure, your body will react by moving fluids from the capillaries to what's called the interstitial space, or basically the space between your cells. And so you will start retaining or holding on to water, hence the edema. Now, there are certain groups of people that are going to be at higher risk for seeing edema, one of which is females will be at a higher risk. They're going to be more up to this 10 to 15%. The higher of dose you get, anywhere from 2.5 to 5 milligrams is going to be lower. Once you get up into that 10 milligrams a day range of amlodipine, then you could be falling into that range, okay? People with diabetes are going to have a tougher time with edema just because of what diabetes does in the body. There tends to be issues handling some of that movement and fluids in the first place. And then as far as the edema, it can show up usually within 4 weeks, and the longer you're on it, we tend to see a higher incidence upwards around that 6-month mark. So those are some of the risk factors that you'd be looking at that will point you to a higher incidence of that water retention. Okay, there's some other side effects that you need to know about. Not common, most of these are less than 5%. You can experience heart palpitations. Again, this is going to be dose related. We see more of it at the 10 milligram dose. Also, again, going to be more common in females, okay? Fatigue is something we can see in around 5% of people. Again, this is probably related back to the vasodilation. We see this in some of the other blood pressure meds like metoprolol, which I made a video on that as well. People can get the blahs, the fatigue, the tiredness. There's a few others. You can experience flushing, only 3% of people, nausea, 3% of people, and dizziness. Again, this is going to be more related to the dose that you're on. The higher the dose, the more you'll experience dizziness. But again, not a huge rate at which these are occurring. It's just good for you to know. One thing I do want to talk about, if you look at the literature, if you look at the studies, they'll say constipation only happens in roughly 1% of people. In my experience, just talking to patients who've taken it, I see it occur more often than that. The calcium channel blockers as a whole are kind of known for causing it. So I just wanted to throw that out there, that sometimes in the real world we do see a little higher incidence of constipation. But far and away, your big side effect with amlodipine is going to be the edema. So keep some of those risk factors in mind. If you've taken amlodipine, mention it in the comments, because I think that's helpful for other people to learn from your experience taking the medication. And of course, if there's other video ideas you have, drop them in the comments. That would be great. So I hope this was helpful. Appreciate your feedback in the comments. And until the next one, this is Curtis Alexander. Thanks.